Good morning. Hello, my name is Dr. Mark Sishan. I am a professor and the chair of the Department of Emergency Medicine at Loyola University and the director of Emergency Medical Services for Loyola University Medical Center. Thank you for joining us today. We are honored to have Cardinal Blase Cupich, Archbishop of Chicago, on our campus, and we enthusiastically support his efforts to stem the tide of gun violence. At this time, I'd like you to please join me in welcoming Cardinal Cupich.
Thank you, Dr. Sishan, and I'm really proud to stand on the same stage as these doctors and medical professionals. As I said when I came up on the stage, they're all so young-looking. They make me feel old. When I announced our comprehensive anti-violence initiative last year, I noted that ending the epidemic of violence would take many hands and many minds, but that just because we could not do everything in the urgent time frame an epidemic requires, that doesn't mean we shouldn't do something. It is irresponsible to just shrug our shoulders and declare the problem to be unsolvable. Since that announcement, I have tried to educate myself. I have visited places where we must address the root causes of violence, mentoring centers, school classrooms, Catholic Charities facilities. I have joined thousands in walks for peace in neighborhoods where killings happen every week. I have blessed a caravan of young people leaving for Washington, D.C. to demand their right to life. I have traveled to Springfield to beg for common sense gun control measures that civilized nations around the world enjoy, but for which we wait, largely in vain. As some argue, we have to do everything before we do something. But nothing has inspired me so much to take up this call for action as the nights I have spent praying and weeping with families of gunshot victims. Their pain was palpable, their voices passionate, their cause contagious. So while debates continue balancing death and maiming against the inconvenience and cost of licensing gun dealers, or even the putative rights to own assault weapons, deadly ammunition, and other items that do not belong anywhere except in the hands of military personnel trained to protect us, I come here today to stand with those who are the real authorities on the epidemic of gun violence. All of us today are united in demanding that those we elect have the moral courage to take the steps that can save lives. Maybe not all the lives, maybe not every day, but ask those who grieve if their child, their brother, their mother was not worth the effort to try. These emergency and trauma health care professionals and pastoral care associates are more than ready to discuss how we should weigh the price of lives lost, diminished by injury and haunted by grief and fear, against the right to sell weapons in shops we are told are too expensive to license. So today, I call on the elected officials of Illinois. Listen to these people. Listen to the young voices of teenagers, school students. They are the real experts on gun control, and I ask that they act to see that SB 1657 becomes law. We cannot make Indiana's laws stronger or Missouri's laws stronger, or block the 60% of guns used in crimes that come from those places beyond our state's borders. But we can have an impact on the 40% of these firearms that are purchased here. I say it again, just because we can't do everything doesn't mean we shouldn't do something. I greatly admire the healthcare and pastoral professionals who work in this real field hospital they also are victims. They suffer the anguish, heartache, and pain as society calls on them to heal body and spirit and do miraculous things. And yet, with the full knowledge that all of this, the bloodshed, the grieving families, the lives forever altered, are all completely, utterly preventable. Thank you for being here today. And thank you, professionals who are with me on this stage, for all that you do in bringing light and focus to this important issue.
Thank you, Cardinal. Your words inspire us all to do more. We are used to thinking of gun violence as a criminal matter, but it is also a public health issue, and it has reached epidemic proportions. About 33,000 people die in firearms-related deaths every year in the United States, according to the CDC and prevention. And that's more than the combined total of people who die each year from fires, drownings, and motorcycle accidents. Here at Loyola, our emergency department treated 283 gunshot victims in fiscal year 17, nearly double the number from 2015. Gun violence is a public health epidemic in America. It has been 2 decades since there has been any substantial improvement in the rate of gun deaths. One of the reasons is funding dried up in 1996 after Congress and the federal government restricted gun research. In 2012, the CDC devoted only $100,000 to studying gun violence. As an academic medical center, we believe time is long overdue to treat public health epidemic like any other health issue. We need to conduct research and take a scientific approach to combat gun violence. Such an approach has been successful in treating polio, HIV/AIDS, and countless other diseases. The same can be true with this plague of violence. Let me repeat, gun violence is a public health epidemic. Spring is often thought of as a time of renewal, growth, and new life. But the experience in the emergency department can be quite the opposite this time of year. When the weather warms, the number of gun violence victims soars. Our doctors, our nurses, and emergency personnel rush to give aid and to save lives. In the waiting room, chaplains console the traumatized mothers, fathers, grandparents, brothers, sisters, sons, and daughters. As physicians, nurses, and caregivers, we are on the front lines of the battlefield. It takes a toll on us, but far worse, it is taking a toll on our communities and society at large. We cannot just react when a person is wheeled into our emergency department. We need to do more to prevent violence outside our walls. That is why we are proud to stand beside Cardinal Cupich today to urge our legislators to support Senate Bill 1657. When other businesses like liquor stores and nail salons must be licensed, it doesn't seem like too much to ask for common sense gun shop registrations. Regulations like employee background checks, video security, and inspection by law enforcement. If one life is saved by this legislation, it would be worth it. We cannot turn a blind eye to what is happening on our streets or only pay attention when a mass shooting occurs. Gun violence is a public health epidemic. The cure will not come in a magic bullet, but a multifaceted solution can be pieced together using evidence-based research, community involvement, and legislative action. So thank you on behalf of those that are trying to make this change. Next, I would like to ask my colleague, Chaplain Michael Hayes, to address the issue.
Thank you, Dr. Cishon, and to all of our assembled guests, and to our special guest, Cardinal Cupich, who inspires us all to seek nonviolent solutions for lasting social change. 2 years ago, Dr. Cupich and I first appealed to the public to acknowledge that our community's gun violence should be viewed as a public health epidemic. Since that time, Loyola's talented caregivers have found innovative ways to treat and support gunshot victims and their families, both while they are here for care and even after they are discharged. We are also researching the root causes for this violence so that through better understanding, we can come to prevention. While we are energized and proud of the work we are doing at Loyola, we know that other area hospitals are also committed to combating this crisis in the communities that they serve. We are yoke fellows with them in this work. The gun dealer licensing bill is a common sense measure that will require gun dealers to be held to the same standards as many other businesses. Employee background checks and employee training, required record keeping, and allowing for regular inspections. It is a solution whose time has come. How can I be so sure? In the last 3 years, Chicago has seen more than 10,800 people shot and 1,800 people killed. How can I be so sure? Experts estimate that the annual social cost of gun violence in America is $100 billion. We stand today to remind everyone what we as caregivers do and why we see this moment as an urgent one. Hospital caregivers support individuals and families through devastating loss every day. Gun trauma envelops whole families in misery, anger, fear, shock, and life-altering stress. It is unremitting in its regularity here in Chicago. Of course, as one observes the laws of cause and effect, there is no denying the fact that certain of our patients are lawbreakers. While we care for them to the best of our ability, law enforcement waits for the proper time to take them into custody. But the gun violence epidemic we have in metropolitan Chicago robs from all with impunity. And so we have also cared for innocent bystanders, for people whose only fault was being in the wrong place at the wrong time of the wrong outbreak of gunfire. Our mission is to care for every person who walks through our doors and to extend that same compassion for their families. Therefore, we urge our lawmakers in Springfield to have the courage to listen to the voices of all who are gathered here. As caregivers, we celebrate every victim our efforts are able to save from gunshot fire, and we cry when our efforts are in vain. And when we cannot save someone, the pain is palpable, and the futility of this meaningless loss of life leaves us feeling hollow inside. For too long, we have waited for a lasting, common sense policy that would help us stem the tide of this public health crisis in this community that we love. We wait no longer. For too many of our citizens, tomorrow is not guaranteed. There is no time to wait. We will now take questions.
I have, of course, I've gone down to Springfield to talk about a number of bills that were being proposed, and I have been in contact as well. The vote is very close, is my understanding, and it's going to take bipartisan support. I think in the Senate, 30 votes passed it, which was a minimum, and they need 36 for the override. There are people on both sides of the aisle who in fact could be important votes for this to go forward. So I want to make sure that people on both sides of the aisle take their responsibility seriously here.
The governor says it's not needed. Do you think he's wrong?
Yes, I disagree with that, and I think all the people on this dais here disagree with that. Law enforcement wants it. They know that they have to have a way to track these weapons. They have to have a way to follow up once crimes are committed. There has to be the threat that people cannot have these guns with impunity. And we also have to make sure that we take leadership here in the state of Illinois, even though places like Indiana and Missouri do not have this. Somebody has to step forward and set an example, hopefully, that this will ripple throughout the Midwest. Well, I think that every state always has its own legislation by which citizens are protected, either in terms of health reasons, such as barbershops or others who provide different services. We are the United States of America. We're not just a federal republic. And so states have needs that need to be addressed by their own legislation. And I think it's very compelling that you have the convergence here of medical professionals, law enforcement, and religious leaders coming together and saying, this is a serious problem that needs fixing, and our voices should not be ignored.
Well, when we look at our turnover rate for nursing staff and what we might consider the concept of burnout, these are things that are realistic. The stresses of daily life, coming in and constantly having to address traumatized individuals, dealing with their families, and a disproportionate share of that in the sense that most hospitals don't see the numbers that we do. Our colleagues at other trauma centers in the city see sometimes more, but the same thing resonates. It's taxing. It's a part of your soul that goes along with each of the patients you care for.
And you also see the impact of these high-powered weapons as opposed to a single gunshot. Now we see people who've been shot multiple times.
Yes, the concept of the multiple shooting victim or multiple gunshots is commonplace. It's not the one-off like it used to be. It's much more common now. Automatic weapons, high-volume magazines, having someone shot 3, 4, 5, even up to 19 times is not the aberration that it used to be.
I wonder too, as you see these mass shootings in other countries, I would think you all have to go through some training, practice sessions. Does that weigh on you at all? When is it not going to be a practice? Might we also be limited to something?
We did research several years ago that showed the question was always in a disaster setting, whatever the disaster might be, the anticipation that 13% of your staff will walk off just because of the stresses involved, child care issues at home, pet care issues, farm care issues. We actually did a study that found that number is about 28% of staff will just not be able to handle and will walk off at that time or not return. That's a telling number. That indicates that despite training, despite the fact that you signed up to work in an emergency department, that what you could see can be so overwhelming, that's a telling number. When one of the biggest things that's needed in a mass shooting is kitty litter for the floor because staff is slipping and falling on the blood that's produced in a mass shooting that's on the floor, that's something that is of concern. America has to stop being sensitized to that.
Cardinal, several votes are needed to override
seems to me that leadership demands at times that people stand up for what's right and educate those that they serve. It is not just a matter of taking a poll on where people are, but moral leadership that we expect of those who we elect into office requires them at times to say what's right. And that, I think, is important for them to consider at this moment. When I hear, for instance, arguments that this is costly because there will be fees for these licensing, consider the amount of money that is lost every year just at this hospital because they're not reimbursed for the cost to take care of those who lack insurance and coverage. Think of the cost of families that many times try to scrounge a few dollars to bury their children. Think of the cost of the allocation of resources of hospital in terms of the expertise and the art of medicine that could be used for more important things and things that, in fact, really bring about curing in the lives of people rather than violence that erupts on our streets. So I can't hear the argument about cost. For me, it is an argument that falls on my deaf ears, especially when I compare the cost of not doing anything. Well, I think that it's very important to realize that there's a lot of money involved in this. And there are people who are advocating that no action be taken because it will hurt their bottom line. The gun lobby, many times, in my experience, and I was a hunter, they do not represent hunters who want guns for sport, but they represent gun dealers and merchants and vendors who reap the high profits of these gun sales. So I think we need to recognize that and make sure that, as these young people in Florida said, let's follow the money. Let's see where politicians are receiving funds in order to run for office, and let's call people out on that. I think it's important for us to be honest about that in our political discourse.
I'd like to thank everybody for attending today. We'll have an opportunity. Please enjoy some of the refreshments. Thank you on behalf of Loyola.